Mr. Smith, my name's Andy and I'm going to be your student nurse today. I'm going to do a sterile dressing change on your wound, okay? So first let me quick verify what's your name and birthday. Alright, and that matches the wristband, so I have the correct patient. And now I'm going to review the chart to see the measurements from yesterday, this wound change to see, that way I have a baseline of what, if the wound has gone down or not. So first I'm going to take this bath blanket and I'm going to first make sure, as I'm doing this, Mr. Smith, have you had a sterile dressing change? Alright, and you remember kind of what they did yesterday, right? Okay, well I'm going to do the same sort of thing. Also, what's your pain level at right now? Okay, it's at a 7, so I'm going to go ahead and administer a pain medication, and then I would wait 30 minutes before continuing just so the patient isn't in any excess pain when I'm doing this. Alright, so 30 minutes later, I'm going to use a bath blanket to provide privacy, and I'm going to leave only the wound exposed. Alright, are you still warm enough? Okay, I'll cover up those feet a little bit more. So as you can see, I only have the wound showing. Alright, now I'm going to perform hand hygiene. And I'm going to place my biohazard bag, folding it over so I have a cup. I'm just going to put this right here, okay? And I'm going to apply clean gloves. Before I get going with my supplies, Mr. Smith, I'm just going to first make sure to remind you, don't touch the wound once I get it exposed, even though it might itch or cause some pain. Just let me know and we'll work on that. And then also, please don't touch my sterile field. And then also, do you have any allergies that I need to be aware of? No? Okay. Perfect. So I'm going to open my applicator and I'm going to get that ready. And now I'm going to remove the dressing one layer at a time. And as I'm doing this, I'm checking to see if there's any secretions, and I'm going to assess the wound. Right, so there's no drainage on the outermost ones, which means your drainage has gone down, Mr. Smith. That's really good. And there's a little bit on these top ones. It's a little yellowish. And now I'm going to take this out, and there's a little bit of pus, but nothing that I should be too concerned about. And then I can see that there's redness coming through, which means the wound is healing well. And then there's a little bit of redness around, which means that the infection is still present, but it's going down some. So I'm going to measure the wound. First I'm going to do the depth. Alright, that's about 1/2 centimeter. I'm going to measure the length. It's about 11 centimeters in the width. Which is about 3 centimeters. And now I would compare those with last week's measurements. And now I'm going to remove my gloves. And I'm going to perform hand hygiene. You still doing okay, Mr. Smith? Okay, good. I'm going to raise the bed up to a more comfortable position for cleaning. And I'm going to do hand hygiene one more time because the bed's not quite clean. Okay. So now I'm going to get my sterile field ready. I'm going to open up my kit, only touching the bottom and the outermost gloves. Pulling away. my sterile gloves. Again, I'm using sterile procedure, so I'm not touching more than the outer edge of my stitch. So this way, so I don't contaminate my sterile field. Only touching the inside. Only touching the sterile part of the glove. And I'm going to touch the inside of it because it's sterile. And just drop. Take everything out. I'm going to start by pouring in some sterile water. And I'm going to open up my gauze. I'm just going to go ahead and open everything up to get prepared. And I'm going to keep this one out for drying purposes. And keep those out for drying. Okay, last one. And now this is, since that was sterile from inside my sterile kit, then my Q-tip should still be okay. So now I'm going to begin by pulling these apart. I'm going to wrap one piece of the 4x4 around the Q-tip, squeezing any excess solution. I'm going to start with the cleanest part. I'm going to just throw that straight in my biohazard bag. And then another one. And I think we only need one more. Are you still doing okay, Mr. Smith? Oh, I think I missed one spot, so I'm going to do just one more. Okay, now I'm going to take this dry 4x4 and I'm just going to dry it once and throw it away. And now I'm going to take my wet 4x4 before, and I'm going to kind of twist it up so I can pack the wound. Okay, and I'm going to take this dry 4x4 and open it up to cover there. And now I'm going to put on the top layer with the blue side up. Just going to lightly tape that down. I'm going to remove my gloves. Don't remove the biohazard bag. And remove the bag. Alright, Mr. Smith. Are you feeling okay? How was your pain during the procedure? Did you feel like the pain medication helped? Okay, good. How's your wound feeling now? Is it feeling better? That's good to hear. So now I'm going to lower the bed back down to the lowest position. And then can you kind of explain to me what I did? That way when you get out of here you can do it at home. Yep, that's right. I first removed it and then I clean it up good with that sterile water, and then we replace that and we make sure to measure it. That way we can check to see if it's going down. So now I'm going to clean up my area, and then I will leave you alone, Mr. Smith. Thank you.